your host and the consumer quarterback, Brandon Rhymes.
And welcome to the Consumer Quarterback Show, always helping you win in any marketplace. And we want to help you be a more informed consumer, be alert of some of the different scams. And of course, you know, with artificial intelligence and technologies out there, that's an ever-changing space as well. And we'd like to introduce you to all of our expert contributors. We've got some really awesome expert contributors, CPAs, financial advisors, healthcare industry experts, and all types of great home service providers as well, associated with the Consumer Quarterback Show. So we got a great lineup for you today, as always. Nick Shriver, Decorating Elb, is going to be on the program. Tom Rydberg, he's our mortgage expert contributor. We're going to talk about Wells Fargo getting hit with a record $1 billion settlement, another lawsuit for the big banks. So that's coming up with Tom Rydberg with DK Mortgage. And we're going to be kicking off here with Gulfside Healthcare Services. In studio, we have Kathy Postiglione. And we also have Jennifer Williams, so we're going to be talking with them here in just a moment here on the Consumer Quarterback Show. Before we do, we always like to feature our real estate listings live on air as part of our strategy to help our sellers sell faster, profit more, and have that expert experience that they have with the Consumer Quarterback Show and the Platinum MVP team at Keller Williams Realty. We got a brand new listing here at Beth Street in Dade City. This is 37716 Beth Street, Dade City. So to our northern listening audience here, we've got a beautiful property here, zoned agriculture. We got 3.3 acres. A lot of people love that rural feel now. They're moving out into the suburbs. They're moving out of the big cities, going out to these little bit more rural and rustic type scenarios. Just 2 miles from historic and trendy downtown Dade City. Downtown Dade City is actually a pretty cool little spot. Some great restaurants and bars down there, and just some fun places to go hang out. Updated 3-bedroom, 1-bath, already plumbed for a second shower. You got numerous upgrades that were completed recently as well. Best Street, Dade City, beautiful property. You can see the interior pictures on our website at platinummvpteam.kw.com. Also, 3704 Burger Road in Lutz, Florida. This is a $2.4 million listing of mine. Gorgeous Mediterranean palace right here in beautiful Tampa Bay. 10,000 square feet, 10 bedrooms, 12 baths. You got no CD or HOA. You got a beautiful oversized pool, indoor pool area with a full bar and an oversized deck, tennis courts, library, movie theater, sauna, 2 master suites, a grand balcony, and more at our beautiful new mansion listed on Burger Road in Lutz, Florida. You can see all of our real estate listings at platinummvpteam.kw.com. Yeah, special shout out to our troops and our veterans out there. Thanks for all you do supporting. And sad to hear that story out of New York where they're kicking the veterans out of homeless veterans out of hotel rooms in lieu of illegals. So we'll talk about that in our next show coming up on tomorrow's show. But we want to give a shout out to Innovative Solar also. Innovative Solar, longtime friends of the program. If you're thinking about solar, they have residential, commercial available, and we want you working with innovativesolarfl.com. You can check them out online, innovativesolarfl.com, official sponsor of the Consumer Quarterback Show. All right, let's welcome in Kathy Postiglione. Welcome back.
Thank you so much.
And you are the Chief Operating Officer, a Senior VP of Business Development.
That's correct.
Tell us a little bit more about what you do over there.
Well, I oversee all of patient care services, including compliance, education, and it's quite an exciting responsibility.
Yeah, that's awesome. Seems like you've got some tenure there, too, as well. Been around for a while.
I have. I'm going on my 19th year.
Congratulations. That's awesome. Very cool. And we wanted to introduce as well Jennifer Williams today, Director of Patient Care Services as well. Welcome in.
Thank you.
Absolutely. Awesome. Tell us a little bit about your position there as well, Jennifer.
So I've recently transitioned into the role of Director of Patient Care Services. So I am overseeing our nurses and our nursing assistants as we provide direct care to patients throughout our entire organization.
Wow. Yeah, that's a lot of responsibility there.
It is.
Tell us a little bit more about what your role and background are.
So I've been a nurse for 20 years, and I have worked in a variety of settings, and I got into hospice about 6 years ago, and really just found my passion for taking care of these patients at their time of need. And I advanced my career through becoming a nurse practitioner, and I worked with Gulfside as a nurse practitioner for several years, and then I moved into this role recently so that I could just expand my ability to help our patients.
And what does hospice mean if folks don't really understand or know what that is?
So hospice is the type of care, medical care, that you receive at the end of life. So when you get a diagnosis and that illness gets to end stage, there's not really anything medically that we can do to make that disease better or cure it. And we transition over to hospice, where we focus more on quality of life and symptom management.
Yeah. Yeah, and I love the fact that you have chaplains on staff as well.
We do.
That's such an important role there as well. Kathy, tell us a little bit about that role with the chaplains.
It's a wonderful role. We have chaplains and social workers that work along with our nursing team to help the patients and the caregivers. Actually, for the caregivers, we're finding it can be quite traumatic to find out that their loved one is going to be passing in a few months. So the chaplains work a lot with both patient and caregiver to see if there's any spiritual need or any items that they'd like to discuss before they die, or any concerns the caregivers may have. And our social workers help with any resources that the family may need after the patient has died.
Yeah, that's challenging time being in that end of life situation, and then you have not only the family there, the caretakers, and then your staff, and then it's great that you have chaplains that can help kind of ease in those trying times. That's really important.
It is.
Yeah, that's great. And also, when you think about the impact on families, it's a lot of times it comes down to the one person in the family. She's been the one that's been in charge most of the time, and she's the one that always kind of voluntarily, raises her hand and says, "Sure, I'll jump in and do it." Right? Every family has one.
They do.
Right? They have that that blessed heart, or that person that has that deeper sense of calling to be that person in the family.
That's exactly right. And sometimes it involves family members coming from out of town who are worried that they weren't there sooner. They deal with a lot of feelings that way too.
Yeah, absolutely. If you just joined us, we're talking with Kathy Postiglione. She's the Chief Operating Officer and Senior VP of Business Development at Gulfside Healthcare Services right here in Tampa Bay, longtime friend of the Consumer Quarterback Show, as well as Jennifer Williams, Director of Patient Care Services. Jennifer, how does this model of care impact the patients and families?
So we really like to focus on our patients and their families as our patients. So we try to bring all of our services to the patient to really ease any kind of anxiety, any suffering in the location where the patient lives. So we bring our staff in and become very comfortable with that patient, and we head our teams with nurse practitioners. So everybody from the top down has that expertise and that support on the team level, and we really get to know our patients individually. And we just really like to keep it very personalized to that patient.
Yeah, and so you have the hospice care, you have home health care, as well as palliative care.
We do.
Would you guys kind of outline a little bit of the differences there for us?
Sure. So palliative care is a model of healthcare that also is like hospice, where it focuses on symptom management in the presence of a long-term chronic illness. But with the difference between hospice and palliative is that you can still be receiving active treatment for that disease at the same time that you're receiving palliative care. So palliative becomes a partner in your healthcare with your other specialist. And it's really focused on how do you live with this chronic disease, and how do you make the best of your life, manage your symptoms. And then you have that expert eye that says, we've really exhausted all that medical services can offer for you. Maybe it's time now we want to focus more on quality of life, and when you become appropriate to transition over to hospice.
Right. Yeah, that's perfect explanation there. Now, one of the things with our aging group of baby boomers and our population shifts, and of course even in Florida, of course a lot of people move to Florida to retire, we're noticing nursing shortages across the country. Is Gulfside looking to hire in those positions?
We are actively recruiting for nurses and nursing assistants. We are partnering with local universities and schools of nursing. Even we partner with the local high school for their CNA program out of their healthcare academy. we really like to bring that staff in and train them in the hospice model. So we even hire new grads. We're very supportive, and we like to educate, and we like to promote within. We have several LPNs who have gone on to get their RN that are moving into those positions with us very soon.
Oh, wow.
And so, yeah, we're definitely looking for nurses, and we love to train them.
It's always that seems to be a challenge, right? Nurses, doctors, healthcare in general, and some other industries. But what about internships? Are there like internships available?
Yes, there
nature?
are,
Yep.
even for our physicians as well as our nurse practitioners. And we are looking at new graduates from nursing programs that we can have them intern for a while first as well.
Yeah, that's awesome. We're talking to the Gulfside Healthcare Services here on the Consumer Quarterback Show today. Gulfside.org website is gulfside.org. Also, you can call directly at 800 number here is 800-561-4883. 800-561-4883. And we're talking with Kathy Postiglione as well as Jennifer Williams here on the Consumer Quarterback Show. And so, yeah, hiring, there's definitely need there. And I think when you look at, kind of the climate of the universities these days, right? More trades, more plumbers, more, if you ever need a plumber or electrician company, AC company, like you got to have them,
Yeah.
That's
and
right.
some of these other,
That is right.
I think the kids, a lot of times, the kids or even the parents, kids are going to school with they're like, I don't know what I want to do. And then they end up taking some kind of a degree plan that doesn't really get them anywhere. So you might listen to that, folks. You might want to be getting into nursing. You might want to start thinking seriously about that. And, maybe some people, you start as a nurse and then you start saying, hey, maybe I want to take this further. We were talking a little bit before the show about some of the things that you can do to advance your degree once you get your nursing degree.
Oh, nursing is endless possibilities on where you can go. You can do direct patient care. You can go into leadership. You can go into, entrepreneurial, maybe start something that doesn't even exist yet. Nursing is just endless for possibilities. But then if you do want to do clinical care, you can go back and get your advanced degree, become a nurse practitioner, and take on that more, patient-focused care at that nursing level.
Right. Yeah, that's great. It's a rewarding career in a lot of different ways. Challenging in some cases, I'm sure. Also, there's this new, telemedicine. I say new. It's been around for a while, but telemedicine is an interesting. Let's face it. We all have these different phones, and I almost said iPhones. Some people have droids or whatever, but you have these technologies where you can zoom in and you can kind of do a little diagnosis over the phone, and hey, I think I got the home test. I tested positive for this or whatever it might be. What do you recommend? So you don't really have to be as face to face as we used to be.
Mm-hmm.
Are you noticing that application with your company too, or is it more just hands-on?
We were very lucky that we were able to embrace some of that technology during our, recent pandemic and be able to still meet the needs of our patients through the use of technology. So it made being able to care for patients, easier in challenging times.
Right. Yeah, absolutely. And Gulfside Healthcare Services is a nonprofit organization. I think that's important to point out. So you're looking for donations, volunteers. I think even high school kids can get involved, and maybe get involved with your thrift stores. You got multiple thrift store locations throughout Pasco counties and other. Can't remember if we're into Pinellas yet or where we're at with those.
With home health, but not
the thrift stores. Okay. Awesome. So I'll just kind of ask you final thoughts. Kathy Postiglione, Chief Operating Officer, final thoughts.
I'd just like to share we're so proud of our clinical team. That would be the medical services, our practitioners, our nurses, CNAs, that's our assistants, as well as chaplains and social workers that throughout the pandemic, they were just a stellar team. They went all out, and we did not lose one staff member. A lot of other companies had tremendous turnover, and we're very proud of the fact that we took very good care of our staff.
Same question to you, Jennifer.
Just it's such a rewarding field, and it's such a compassionate company that we're part of, that we get to do this for our patients, but that we support each other, and we make sure that we're all coming in and taking care of the patients and taking care of each other, and it's just such a positive experience.
Yeah, I love it. Gulfside.org. Check them out online. Gulfside.org. 800-561-4883. Thank you so much for tuning in and listening to this segment. It's an important segment. Nursing is a great idea for any young folks out there, or hey, even if you're a little bit older and you're thinking maybe I'll go back into school. Hey, nursing is a strong need, definitely for that. So, Kathy, Jennifer, thanks for coming in.
Thank you.
Thank
we
you.
appreciate it. Always great information, as always. Appreciate that. All right, taking a quick break. Coming back, we got Tom Ryberg in the house. He is our local expert contributor for all things finance. Tom Ryberg, DK Mortgage, coming up here on the Consumer Quarterback Show. I was going to talk about this Wells Fargo record setting. They had a $1 billion settlement to pay to investors. Interesting shareholder lawsuit. What came of that? We'll be right back. Consumer Quarterback Show, consumerqb.com.
Hey, everybody, it's the Captain, Matt Bruce, and you're listening to my buddy, Brandon Rhymes, a consumer quarterback. Sell, Brandon, sell. Together.